Hi students. So in the previous video of teeth arrangement, we have discussed about the arrangement for anterior teeth and the guidelines for selecting the teeth. In this, we will be discussing about posterior teeth selection and teeth material. Now coming to the mandibular guidelines. Line 3, which is the line following the crest of the residual ridge from the canine to the retromolar pad, aids in the anteroposterior positioning of the posterior teeth. What is Pound's concept? The mandibular posterior teeth should lie in the triangle formed between the mesial end of the canine and the two sides of the retromolar pad. So if you have your canine here and you draw, and this is your retromolar on the arch, this is your retromolar pad. So you draw a line from this side to your retromolar pad and from your distal mesial stop your retromolar pad. This is called as your Pound's area. So your posterior teeth should all lie within this region, within those confines. It should not move lingually or buccally. That is called as Pound's concept. In the upper, when you're arranging your posterior tooth, all your posterior buccal cusps will follow the distal slopes of your upper canine. Your upper canine distal slope will be followed by all the buccal cusps of your posterior tooth. Whereas in the lower, your distal slope of your canine will be followed by the central groove of all your mandibular posteriors. That should be the ideal positioning based on Pound's concept of your posterior teeth. Now, for the posterior teeth guideline, it should be positioned over the crest of the residual alveolar ridge to improve the stability and the balance. Boundaries of the posterior teeth. The anterior limit should be the distal surface of the canine. In the maxillary arch, the teeth should not be placed on the tuberosity. So, it should end beyond the tuberosity. In the mandibular arch, the posterior limit is the teeth should not be placed over the retromolar pad and the slopes of the residual ridge. That is to avoid the instability. Coming to the buccal limit, if it is placed too very buccally, it can result in cheek biting, denture instability and obliteration of the buccal corridor, which leads to unaesthetic appearance. So when the patient smiles, you're going to see all the teeth from 28 to 28 teeth if you keep it too buccally. Coming to the lingual limit, lingual cusp of the molar are in alignment with the mylohyoid ridge and never lingual to it. Placing the teeth far too lingually can cause crowding, tongue biting, imbalance due to the tongue function, and definitely there will be a loss of stability of the denture, especially the lower denture. Coming to the occlusal plane, the anterior height of the occlusal plane is determined by the lower anterior teeth and the commissure of the mouth. Posterior height is at the level of the 2/3 of the retromolar pad. Maxillary posteriors will be the parotid papilla or 3.3 millimeters above the occlusal plane, which establish the guide of the plane. Coming to the occlusal plane, it should be located in relation to the lateral surface of the tongue and also without blocking the Stenson's duct. Upper occlusal plane is located a 1/4 inch below this. Coming to posterior teeth arrangement, it should aid in retention, preserve the tissue health and aesthetics especially for the premolars, and also help in mastication of the food. The central groove of the lower posterior should be located over the center of the lower ridge. Central groove over the center of the lower ridge. If it is placed buccally, the denture may be tipped up. If low lingually, it may cause crowding and lifting of the denture. Coming to the number of the posterior teeth, it depends on the space availability which is present from the distal of the canine to the retromolar pad in the lowers. If the space is there only for 3 posteriors, preferably drop the first premolar. Coming to the positioning of the maxillary first premolar, long axis should be parallel to the vertical axis when viewed from the front and the side. and the palatal cusp is kept 2 mm shorter than the horizontal plane, whereas the buccal cusp is in contact with the horizontal plane. So it is parallel to the long axis from the front and from the side. There is no tilting. Coming to the maxillary second premolar, again the long axis is parallel to the vertical axis from when viewed from the front and the side. Both the buccal and the palatal cusp will touch the horizontal plane. Coming to the maxillary's first molar, the long axis slopes buccally when viewed from the front and distally when viewed from the side. The mesopalatal cusp will be in contact with the horizontal plane. Coming to the maxillary second molar, it is very similar to that of the first molar, the only difference being that it is slightly more steeper. That is, though the angulations will be the same as the first molar, none of the cusp will be in contact with the horizontal plane. So the long axis slopes buccally more steeper than the first molar when viewed from the front and distally more steeply when viewed from the side. All the four cusps are shorter than the horizontal plane with the mesopalatal cusp closest to it. Coming to the mandibular first premolar, the long axis is parallel to the vertical axis when viewed from the front and the side. The buccal cusps are 2 mm above it. The long axis parallel to the vertical axis when viewed from the front with both the cusps touching the horizontal plane. That is for the second premolar. Now coming to the first molar, the long axis slopes lingually when viewed from the front and medially when viewed from the side. In the upper, remember, it is buccally and distally. So in compensation, in the lower, it is lingually and medially. All the cusps are at a higher level above the horizontal plane than that of the second premolar. Now, the buccal and distal cusp being higher than the mesial and the distal, compensating curve starts from the first molar. So, this is where the compensating curve will start. So, it will go like this. Okay, that's how the compensating curve will come. The central fossa is aligned with the canine retromolar pad reference. Coming to the mandibular second molar, the lingual and the mesial inclinations of the long axis of the tooth is more pronounced than that of the first molar. All the cusps are at a higher level above the horizontal plane than those of the first molar. Setting of the posteriors. The Stenson's duct is in relation to the occlusal plane, so that should be taken into consideration. Always try to achieve the key of occlusion. The mesopalatal cusp lies in the in the mesiobuccal groove of the lower. So always try to achieve your key of occlusion not just buccally but also in the with proper lingual occlusion. Coming to the compensatory curves. These are artificial curves introduced into dentures in order to facilitate the production of balanced articulation. They are the artificial counterparts of the curves of Spee and Monson, which are found in the natural dentition. Now, this is the teeth arrangement of the mandibular posteriors. This is the buccal view, how the tooth is placed. And this is the, from the lingual side, this is how the key of anteroposterior curve starts. Teeth arrangement for a class 1 relationship, ideally the overjet, that is a horizontal overlap, should be 2 to 4 millimeters and the overbite, which is vertical overlap, is 2 millimeters. Canine relationship, the mesial slope of the cusp of the upper canine opposes the distal slope of the lower canine cusp. First molar relationship should be mesiobuccal cusp of the upper first molar opposes the buccal groove of the lower first molar. That's the key of occlusion. Arrangement of posteriors in class 1 can be set in 3 types. Setting all the maxillary teeth first, then you set the mandibular or then you go to the mandibular. Next way is after setting the anteriors, you first set the mandibular posteriors and then go for the maxillary posteriors. Or you can also do it simultaneously by doing set the maxillary first premolar, then the lower first premolar, maxillary second premolar simultaneously till the second premolar. Teeth arrangement for class 2 relationship. Salient features would be a more horizontal overlap is given, minimal vertical overlap. Canine relationship will be more posterior and lingual when compared to that of the class 1 relationship. Either anatomic or modified anatomic or non-anatomic teeth can be used. The premolar should be ground mesiodistally or one premolar on either side should be removed. Now, depending on the severity of the horizontal overlap, you can actually choose the first premolar or the second premolar depending on what is the space that you require. Now, setting the mandibular posterior teeth for class 2. The lower anteriors are set for the lip support first. Then the first premolar supported by the modulus. The lower ridge is smaller and weaker in a class 2 patient. So the buccolingual inclines are modified to shallow angulation or non-anatomic teeth are selected. For a class 3 arrangement, the mandibular arch is larger than the maxillary arch and the horizontal and vertical overlaps are virtually eliminated, simply coming it to a edge-to-edge relationship. Now, the incisors are set edge to edge. In severe cases, the lower anteriors may be in a more anterior position than the upper. It can be set in a class 3 or a cross bite relationship also. An additional class 3 additional teeth for the third molar or an additional premolar can be placed in the lower to compensate for the excess space availability in the mandible. Now, selecting the lower anterior teeth with a narrower teeth set and leaving slight spaces between the upper anterior teeth to attain normal canine relationship to be done. Eliminate the first premolars in a wide maxilla and a small mandible. So, this is how the anterior and the posterior arrangement will come for a class 1, class 2 and a class 3. Coming to non-anatomic teeth, they were introduced by Jones in 1972. They're basically cuspless or 0-degree teeth or monoplane teeth. There is no cuspal angulation, so they are very easy to set. Bilateral balance with a compensatory curve can be achieved, and 3-point balance with a balancing ramp can be achieved. It reduces lateral stresses. Their indications are for flat ridges, knifed ridges, or large interridge spaces. Coming to non-anatomic teeth, milling type of chewing pattern with broad excursions, debilitated patients, or poor neuromuscular control. Coming to non-anatomic teeth, there is no vertical overlap. Occlusal surface of the upper and lower posterior should be parallel to each other, but the second molar should be 2 mm above the horizontal plane. By developing curved occlusal plane, balanced occlusion can be achieved. The advantages being more stable lower denture during mastication, more vertical chewing stroke, more shear on the chewing stroke, and more tongue space. Disadvantages is that it has less stability to the upper denture, no balance in the excursive glides. Advantages, it is easy to set, less lateral stresses and least anteroposterior interferences after settling. Advantages again will be good for the patients with poor neuromuscular coordination and ridge relationships, especially patients where you find recording of maxillomandibular relationship very difficult. Reduce buccolingual width and sharp grooves and sluiceways compensate for the cusp in obtaining chewing efficiency. Disadvantage is very difficult to obtain balanced occlusion in excursive movements, less chewing efficiency and poor aesthetics. When set on a flat plane, posterior spaces develop, that is Christensen's phenomenon is seen, causing pressure and resorption in the anterior region. So it is not very difficult to attain balanced occlusion. Coming to neutral zone, Always remember, especially for a knife-edged ridge, you try to set the tooth in the neutral zone in an area. So neutral zone is basically the area of the tooth where it is between the area of the mouth where it is between the cheeks and the tongue in a very neutral position. The area of the mouth where during function the forces from the tongue pressing outwards are neutralized by the forces of the cheeks and lip pressing inwards. How do we achieve placement in a neutral zone? So what you do is place wax or maybe impression compound, place it inside the patient's mouth and do mouth movements and the tongue movements maximum. Then you achieve a space, you take out the occlusal rim and make an index with putty or plaster and pour a wax rim into this index and then arrange the tooth using this index. So when you have an index and the teeth is arranged according in that space, you are placing in the neutral zone. So by placing the tooth in a neutral zone, you are achieving a more stable denture, especially in a knife edge or a very minimal ridge case. You are achieving stable ridges where retention is very, very difficult. So with this, we are concluding the teeth arrangement and the selection of the tooth depending on your arch forms and patient considerations and how the teeth should be arranged. Thank you.